CAPS with Erythema Nodosum. Following major surgery, I've been wrestling with a flare that has included what looks like Erythema Nodosum. I've had Erythema Nodosum twice before, which is why I'm pretty confident that I can recognise it. The first time was back in 1993 and it was clinically diagnosed by a GP. The last two times I haven't bothered to seek diagnosis as there isn't any effective treatment anyway. It just takes time, rest and some ibuprofen. Please remember, I am not giving you medical advice. Erythema nodosum manifests as large, painful, swollen lumps under the skin that are usually concentrated around the lower legs. It looks like someone's whacked me all over with a cricket bat. But what they are is pockets of inflamed tissue in the fat layer of the skin, and what causes them? Nobody knows. Erythema nodosum is associated with inflammatory bowel disease, but is it associated with CAPS? Given that it is an angry innate immune system problem, it's not such a stretch. In 2018, a case study was published describing a patient with Muckle-Wells syndrome, which is a type of CAPS, mutation T436I, and erythema nodosum, suggesting the first recorded link between the conditions. Cut back to me and my A439V mutation. When I asked other family members about erythema nodosum, 3 female cousins with the same mutation confirmed that they've also had it. Unfortunately, with rare diseases, we don't get enough data to be meaningful, but 4 cases in one family of mutants has got to be suggestive. And I'm the only one who's had severe inflammatory bowel disease. Another paper from 2021 describes a Chinese family with a CAPS-causing NLRP3 mutation with all the classic CAPS symptoms, but additional symptoms that are more commonly seen in Behçet's syndrome. Behçet is considered an autoinflammatory disease with an unclear genetic basis. There is a link between Behçet's and HLA-B51. The HLA thing is about how your immune system recognises what's you and what isn't you. But having that genotype doesn't guarantee that you'll have Behçet's. Common symptoms associated with Behçet's are mouth ulcers, genital ulcers, and erythema nodosum. Inflammatory bowel diseases are also more associated with Behçet's than CAPS. There's much more to Behçet's, but these key symptoms appeared in the CAPS patients in this paper, and they happen to have the same exact NLRP3 mutation as me. And these same things are happening to me. The authors state that this is the first report of CAPS associated with Behçet's. Is that what's happening? Or are the biochemical pathways of the two diseases maybe just not that different and the symptom overlap maybe just hasn't been noticed before? Putting aside the extra gastro stuff and just coming back to the erythema nodosum, remembering that 3 of my CAPS cousins have also had erythema nodosum, I'm prepared to go on record to say that CAPS and erythema nodosum is a thing.